All right. Well, I hope everyone here had a great Thanksgiving. Thank you so much for joining us in our fourth and final session of the Cholesterol Masterclass hosted by us here at the Family Heart Foundation. And the topic today is going to be how to make the most of your healthcare provider's visit. Just a few housekeeping things before we dive in. As a reminder, this is not meant to be medical advice. This information is for training and for educational purposes. Make sure that you are talking with your doctors about anything pertaining to your treatment or your family's treatment or anything specific to you. All right. And again, feel free to introduce yourself in the chat if you would like. You can change your settings to everyone, or if you want to message us directly, you can do that as well. If you have a question, you can also put your questions in the chat, or at the end, if you hit that raise hand button down by that little reactions guy at the bottom, you can ask your question in real time. Feel free to keep your cameras on or off, whatever you're comfortable with. And again, we want to thank Amgen, who is the sponsor for this Cholesterol Masterclass series. Without them, this wouldn't have been possible. So very grateful that we are able to put this on with their support. All right, unlike previous sessions here, I'm not going to quiz you to start off today, but I do just want to make a reminder that there is going to be a post masterclass survey. It should be coming out in the next few days, probably early next week. And your feedback is super helpful here. It helps us learn what was useful, what wasn't useful, how it could improve, so that we can keep tweaking and learning from the people who were able to join this class. And also on that same note, we will be sending a follow-up email once all of the presentations are put out publicly. So if you missed one or two sessions and you want to go back and watch them, or if you want to go back and reference something you heard, those will all be publicly available coming soon. And without further ado, let's dive into session 4 of our Cholesterol Masterclass. So again, how to make the most of your healthcare provider's visit. My name is Eric Triku. I'm the care navigator here at the Family Heart Foundation. I'm a genetic counselor by training, and before joining, I worked clinically in the cardiovascular genetics space. So what we're going to talk about today, we're going to talk about breaking down the appointment as what to do before your appointment, how to best prepare for your appointment. Then we'll talk about how to make the most of the appointment itself, and then tips and tricks for after your appointment as you're figuring out what your follow-up is going to look like and how to really try and incorporate these things into your life. And then we're going to end it out with talking about staying informed and how to stay up to date on the latest information, the latest science, and then vetting your sources, because we know there's a lot of misinformation out there. Okay, so to get started, I just want to frame this in the ideal world where healthcare is a shared decision-making process. So shared decision-making is an approach where clinicians and patients share the best available evidence when faced with the task of making decisions, and where patients are supported to consider options to achieve informed preferences. In general, healthcare is better when patients and providers collaboratively come up with decisions on what's best. Things like medication, lifestyle changes, dietary things should all be aligned with your goals and your values, not just something you're being told and not questioning, making sure that you're both very much aligned on what the best plan is for you going forward. With that said, let's dive into things you can do before your appointment. So the first thing is finding a provider. For many people, your primary care provider is going to be the perfect person for you. If you've already had a primary care provider that you've been working with in the past, you don't necessarily need a specialist. A lot of primary care providers are very well equipped to help people get to goal. There are also specialists out there that you can consider. So cardiologists, these could be preventative cardiologists, lipidologists, endocrinologists, and many others. There's not necessarily one that's better than others, but if you have some things that are specific to you, it might be worth seeking out a specialist. Some considerations when finding a provider is your previous experience with that provider. So if it's your primary care doctor, do you like the relationship that you guys have? Do you feel like they really hear you when you're talking to them? Or do you feel like you're being brushed off and maybe you want to see a second opinion? Other things to consider are comorbidities. So if you are dealing with high cholesterol and potentially something else, maybe that warrants seeking out a more specialized provider that could handle both of those things. Another big consideration right now is availability. I know it can be difficult to get in even with primary care providers, and some of these specialists, people in lipid clinics might be scheduling many months out. So making sure that it is somebody that you are able to get an appointment with that aligns with the timeline that you're thinking. And then, of course, insurance, making sure that your provider is somebody that is in network for you or covered by your insurance, so you're not hit with a surprise bill. If you don't already have a provider, one of the things I would recommend, again, just finding a primary care provider close to you. If you do want to see a specialist, we do have a specialist map on our website at familyheart.org/find-specialist. This is a map that is searchable. You can put in your area code or city and state, select a difference at the distance from you, and this is a list of specialists that we've vetted over a number of years. It's over 600 different experts, and they are all familiar with diagnosing, treating, and managing cardiovascular risk due to cholesterol and high Lp(a). All right, so now that you have an appointment, you found a provider, the next thing that you should be thinking about is knowing your numbers. So one of the most important things is going into that appointment with an up-to-date fasting lipid panel and an Lp(a) if you haven't had your Lp(a) tested before prior to your appointment. We would recommend doing this about a week out, just because Lp(a) is a send-out test and can take 2 to 5 days for results to come back. So we really want to make sure that you and your doctor have these results in hand as you're going into your appointment. And again, just to reiterate, fasting lipid panel is usually good for most people. Advanced lipid testing isn't necessary. In some cases it can be, but for most folks, a fasting lipid panel will be enough information to help understand your risk and how your doctor should manage you. Another thing that's very important is taking the time to actually write out or type out a list of the medications you're taking. And that's not just cholesterol lowering medications, but other medications, what their dosages are, and how frequently you're taking them. And importantly, I think this is something that often gets forgotten, is to also include any supplements. If you're taking anything that is not prescribed by your doctor, but it's something you're taking regularly, make sure that you have that written down as well. Another useful thing to bring to the appointment would be medication history. So if you were on any lipid-lowering therapies in the past and stopped taking them, or experienced side effects, or any number of reasons why you stopped taking them, write down what it was you were taking, when you were taking it, and maybe why you stopped. Also, if you're being seen somewhere for the first time where they might not have your previous lipid results, trying to track those down could be helpful. In addition to any other outside studies you might have had. So if you've had a coronary artery calcium scan before, getting those results, and a CT angiogram, for example, making sure you have access to those results. In the era of kind of open health records now, it's pretty easy to get access to those either through patient portals or just calling the medical records number at whatever clinic you were seen at before. And having that historical context can be useful, as gives a longer timeline than just where you're currently at with your cholesterol. In addition, knowing your family history is very important when we're talking about cholesterol. So we know that family history is a risk factor and something that your doctor should be thinking about whenever you're being seen by them. So writing out your family history can be incredibly helpful. We do have this great little tool that we built. On the right here, you can see a picture, and there's also a QR code that'll take you directly to that PDF. This is something you can download and print out. And if you see here, it's a little hard to see. I know this is small, but you have yourself in the middle. So that's you. And then check in the box if you have high cholesterol, if you've had a heart attack or heart disease, and what age that was at. Also, this was built specifically for folks with familial hypercholesterolemia and high Lp(a), but it still is applicable to tracking down that family history. So then to the left and right of you is your brothers and sisters. Check off whether they've had any of these factors here. And then down below is your children, and then going up is the generations above you, so your mother and father, and then grandparents. If it's easier to just write that out on a piece of paper, that's great as well. We just try to make this tool so that it helps people kind of think through these things in a more systematic order. And also, one of the things that is important to be thinking about with family history is a lot of times, I remember back when I was taking family histories in clinic, you might ask somebody if they've had a heart attack, or if their family members have ever had heart disease or a heart attack. And then you probe a little bit more and they say, oh, no one had a heart attack, but Grandpa Joe had a stent when he was 60, and not realizing that that's also related to cardiovascular disease. So these are just a couple of the key words that you should be thinking about when you're walking through your family history. So heart attacks, strokes, or even what are sometimes called mini strokes or TIAs, any procedures they've had, whether that's bypass surgery, stents, angioplasty. If anyone's ever mentioned blockages in their arteries, of course, if they have high cholesterol or high Lp(a). Another important thing to think about is aortic valve stenosis, as that's related to Lp(a) as well. And then thinking about outside of the heart, so carotid artery disease or peripheral artery disease, these are all things you should jot down if any of your close blood relatives have had any of these conditions. Another tool that we built is we have a doctor discussion guide. This was something that we developed as part of our Runs in the Family is Not a Diagnosis campaign. So it is focused a little bit on recognizing familial hypercholesterolemia and high Lp(a), but it asks a lot of great questions about your own personal history and your family history. It also has some really good information on there that kind of serves as a light reminder to providers when it comes to things like using risk calculators for people that have extremely high LDL cholesterol that might be more suspicious of FH, and also mentioning that Lp(a) isn't used in risk calculators. So it serves a dual purpose of helping you organize information and also gently reminding providers how they might think about you specifically. It doesn't include medication history, so make sure you have that separately, but we do think it is a nice tool. It's about 2 pages. You can print that out or download it as a PDF and use that ahead of time. So put all those things in your folder. So you have your family history, your medication history, your personal history, and with all of that, we will move on to during the appointment. So one of the things that is very striking to me, and this came out of a study not too long ago, is that time is very limited in appointments. And I'm sure many of you are familiar with this. In a survey of clinicians, they found that 30% of physicians spend between 17 and 24 minutes with each patient, and about 30% will spend even less than that, between 13 and 16 minutes with each patient. So keeping that in mind, we really want to make sure that we're making the most of this appointment time that you have. The one thing I will say there is knowing how long your appointment is scheduled for is important. For example, different healthcare systems, if it's your first time seeing a provider, they might schedule you for a longer initial appointment, 40 minutes, for example. And if it's a follow-up, it might only be scheduled for a 20-minute appointment. So knowing what kind of time constraints you're working with there is going to really help you think about how to make the most of that visit and really focus on the things that are important to you. Other tips and tricks: arriving early is always great. It really helps if there's any sort of line at check-in or anything like that, or parking is a pain, but making sure you're there early so that as soon as your appointment is ready to go, you can really make the most of that limited time that you have. If you have a telehealth visit, making sure that you can log in. Some different hospitals, institutions will use different platforms for telehealth visits. And I think we all know in this day and age that technical issues are the bane of everyone's existence. So making sure that you're able to get in there as soon as possible is very helpful in making sure that you're getting all of that time. And then bringing all of those typed or written out history of things that we talked about to the appointment, or having it up on your computer if you're on telehealth, is going to really make it so you don't have to try and remember all of these things at the time. So with all that said, consider before your appointment what your main concerns are and prioritize. And what I mean by this is really thinking about, in this limited time, what are the top 3 things you want to ask your doctor about, and try writing those out. And one of the things that's important here is being very specific. And I'll go into a little more detail of this on the next slide, but thinking about things like, what is my ideal LDL cholesterol target? What is my risk for cardiovascular disease? Maybe you're more interested in medications and treatment options, and you want to put that at the top of the list. Are there other things more related to diet and exercise that you should be considering? If there are any other indications that you might need to be screened for, is there someone else you should be seeing? Do they need to make any referrals? Things like that. So once you kind of have this overall list of questions that you want to ask, I really recommend trying to prioritize maybe your top 3. Keeping the other ones there, so if time permits, you can get there, but really making sure that what's most important to you is at the top of that list, and having that written out so you're not stumbling over words or trying to recall what you were thinking of. So in that being very specific part, so instead of just saying, what is my LDL-C cholesterol goal, maybe phrasing it more along the lines of, based on the AHA and ACC guidelines, as somebody without cardiovascular disease, I think my LDL cholesterol goal should be less than 100. Do you agree with that? Or saying things more specifically like, I am on medication X, my LDL is at Y. What additional treatments might be available? So trying to make those very targeted and direct questions can help streamline that approach to making the most of that appointment and having a really fruitful discussion there. And again, just as a reminder, on this chart, your LDL goal for those without cardiovascular disease is under 100. For people with cardiovascular disease, less than 70 is the goal. And the most recent statement from AHA says ideally less than 55 milligrams per deciliter. So knowing your goal, knowing where you think you should be, and asking your doctor what they think. Do they agree with your perception of what your goal is? And again, you're not trying to go in and tell them, oh, I went on Google and I read all the random articles about what I think, but being able to say, like, this is based on AHA and ACC guidelines. I believe my goal should be this. Is that correct? I think is a very fruitful approach. All right. So then during the appointment, as you get to talking about treatment options, remember there are many options. You can refer back to Dr. McGowan's previous session on different treatment and medication options for a refresher on that. If you currently are on a medication and you're not at goal set, at the goal agreed on with your doctor, what other options exist for intensifying treatment? Whether that's a dosage adjustment, adding an additional therapy, changing the medication, just really asking to understand what your options are and what might be the best path forward for you. If you're not on medications, what options are available? Again, statins are often the first line, but there are other medications out there, and your risks are unique to you. And again, understanding how aggressively you want to approach this versus maybe taking more of a lifestyle and dietary approach in combination with aggressive medication or more moderate medication, and having those conversations about how to start there. And I think when we're talking about medications, it's always important to understand what are the side effects, what are the risks, and what are the benefits. Again, the benefits, of course, preventing heart disease, but are there any side effects or other things you need to be thinking about? And talk about timelines. So whenever you start a new medication, when does your doctor want you to be retested? And when should you follow up with your provider? Making sure that those things are very clearly articulated and that you're both on the same page there is incredibly important. And if after starting a medication or changing your medication and getting your lipids tested again, but you don't reach the goal that you guys had established, what would the next steps be? So kind of understanding what your plan B, what your plan C is, can be very helpful. Generally speaking, that follow-up after starting a new treatment or changing treatment should usually be within 6 to 12 weeks after the fact, but talking with your doctor about what their preferred approach is always helpful. A couple tips and tricks. So don't be afraid to ask questions. I know personally it can be intimidating when everything seems very rushed and you only have 15 minutes, but if there's something that's not clear to you, making sure that you ask the questions that will make it more salient for you. Also being honest with your provider. So if you, for example, are talking with your provider about diet and you know that some of the recommendations they're making aren't things that you feel are something that you can incorporate into your life, don't just nod and agree with them. Say, I don't think that's appropriate. I don't think that's something that I would be able to incorporate. What other options might be there? Or I know there can be a lot of, for smokers, for example, might not feel comfortable telling their providers about smoking, but having been in these waiting rooms, usually they know, like you can smell the smoke on folks, but having that conversation, they're not judging you, making sure that you're very clear that you're both on the same page here, that your goal is to reduce your risk for cardiovascular disease. Being honest is hugely important. One of the things that I think is also helpful is reiterating back to your doctor the key takeaways. So as you have a conversation about medication options, reiterate back to them what you heard and what you think the plan is, so that if there is anything that you misheard or misinterpreted, that they can correct that and make sure you're both aligned in what the next steps are going forward. Also, asking if there are any registered dietitians or other specialists that would be worth seeing. A registered dietitian could be great. A lot of systems, a lot of specialty lipid clinics, for example, will have dietitians either on staff or in other healthcare systems, just within their own system. There could be dietitians. And if that's something you think would be helpful, can you get a referral for that dietitian? And again, making sure you're clear on the established plan and the follow-up. And one of the things also that can be helpful, and I know this isn't always available, but if your doctor wants a follow-up appointment in however many months, if you can schedule that, if you leave the office, that takes one less thing off of your to-do list down the road. Okay, so talking a bit about after the appointment. So now that you've had a very fruitful conversation with your doctor, what's next? So fill the prescriptions that were prescribed to you. Remember to take your medications as prescribed. Keep track of any side effects you might experience and get retested when you're scheduled. So if they want that 6-week follow-up, make sure that you have that scheduled, or you know what your plan is for getting that follow-up lipid panel, so we can see how those new medications or changes are working. If you can't schedule a follow-up at the time of your visit, one of the things that can be helpful is setting a phone reminder to schedule when you can. Life gets busy. There's a million things that fall through the cracks. I know I'm one of those people that even if someone's calling to schedule from the institution, if I see a number I don't recognize, I might not answer it. So setting that reminder for yourself can be incredibly helpful. Also, finding community support. So one of those things that can help with adherence to incorporating these changes is being surrounded with like-minded individuals. We at the Family Heart Foundation do have a number of Facebook groups for either people with high Lp(a) or people with inherited forms of familial hypercholesterolemia. but maybe there's local options to you, or even just friends, family members that are going through similar things. So finding that kind of support network can be helpful as well. Now, diving into my least favorite part of this world is talking about cost and insurance. So these are a number of tips and tricks and things to be thinking about when it comes to insurance and cost of these medications. This QR code in the top right here links to a tool we have about navigating insurance and cost. And so a couple of the tips and tricks that we're talking about, but has a few more details. So if you're interested in that, I encourage you to go check that out. One of the first things is asking about generics. For statins, for example, there are many cheap, affordable generics out there. You don't need to be on the name brand, the brand name pharmaceutical. If there are generics available, that can really help with costs. Also, shopping around for the best prices. There are different costs based on where you're getting that prescription filled. Maybe a different pharmacy has a better price. One of the other things that can be useful is checking your insurer's formulary. So a formulary is essentially a list of medications that insurance companies will develop that talk about what drugs are approved. There can be different tiers of drugs, which talk about what level the drug is covered at. So if you're being prescribed a PCSK9 inhibitor, for example, your formulary may cover one and not the other. So that can be important to make sure that you are being prescribed the medication that is on your formulary. With the PCSK9 inhibitors, I think that's a great example since there are two out, and they are usually insurers will pick one as their covered PCSK9 inhibitor and not the other. So that can be one of the reasons why people show up at a pharmacy and see a huge out-of-pocket cost, when in reality it would be much more affordable if they were being prescribed the one that was on their formulary. The ways to check that, a lot of times they are publicly available. So if you go to your insurer's website, you can often search for their formulary, or the easiest way, honestly, is just giving them a call and say, I was prescribed this, is this on the formulary? What's the coverage for that look like for you? To further complicate it, formularies do change over time. So sometimes one drug will be covered 1 year, and then the next year they'll switch to another drug. So knowing that if you get hit with something that's drastic change, that might be one of the explanations for why that happened. Another important thing is considering working with if you get insurance through your employer, your HR department. Most places will have folks that work specifically with your health insurer for your company, and you can talk about concerns you're having or medications that you think should be included, like knowing what options might exist going through your employer. And then as we're coming up on open enrollment, as you're picking your insurance plan for the year, taking into consideration the medications you're on during open enrollment. Another tricky thing with insurance costs is the prior authorization process and denials that come from prior authorizations that were not accepted. So brief overview, prior authorizations are essentially a review process set up by your insurance company to make sure that the prescribed medication is medically indicated. A lot of times there can be denials for any number of different reasons. Don't get discouraged by that denial. With PCSK9 inhibitors, for example, the second try is often much more effective than the first try. Make sure you're involving your healthcare provider and talking with them about anything that requires a prior authorization. They'll be the one, usually that is, or someone in their office will be the one handling that prior authorization. Sometimes it's as simple as they didn't mention that you had tried statins in the past, or you were on something. I don't know. There's many different reasons why denials can happen, but a lot of times it can be rectified with that appeal process. All right. So now getting more to the cost part of it. So search for coupons. There are surprisingly a lot of coupons out there, especially for a lot of the generics. There can be ways to get additional discount on your out-of-pocket cost with coupons. Copay cards are also an option for those with commercial insurance. So this doesn't include people with Medicare, Medicaid, or TRICARE, but if you have commercial insurance, private insurance. If you have private insurance and you're being prescribed a drug that has no generic alternatives, often these manufacturers will have copay cards that help with that out-of-pocket cost for you. So the PCSK9 inhibitors, for example, both have copay cards. Nexlizet, Nexletol also have copay cards. These are usually available through the manufacturer's website. So look at the medications you're on. If it's something without a generic alternative, just do a quick Google search for that drug name and copay card, and usually it'll take you directly to it. Again, those aren't available for folks with Medicare or Medicaid, unfortunately, but there are still options for assistance for those with Medicare or Medicaid. One example is Extra Help, which is a program that has an application process. They have some requirements, but sometimes people can get assistance with their medications if they qualify for the Extra Help program through Medicare Part D. There are also a lot of great resources out there to explore. And again, we don't have any relationship with these folks, but just wanted to call out a couple of options out there that might be good starting places if you're coming into issues with cost for your medications. So GoodRx, I think a lot of people are familiar with that one at this point, but they have a lot of good discount codes available out there. Cost Plus Drugs, similar to GoodRx. Amazon now has an Amazon Pharmacy, which can sometimes help you compare prices. And then there are a couple of charitable foundations out there that offer patient assistance. So they're not a pharmacy themselves, but they have charitable funds that are set aside for specific diseases or specific indications, and they offer up assistance for those that qualify. One of those is the PAN Foundation. I really like the PAN Foundation. They have a website actually that they run, which is called Fund Finder. It's just fundfinder.org. And you can go on there and create an account, and it kind of gives an overview of many different charitable organizations and what funds they have available. A lot of these funds are first come, first serve, and usually those might open up at the beginning of the year. And they kind of, once they're full, once they run out of that bucket of money that they set aside, they won't enroll new folks until the following year. But on Fund Finder, you can kind of look at all these different funds available, and you can set yourself up to get email reminders for when a fund does open up. So I encourage you to check that out. HealthWell is another one of these charitable organizations like the PAN Foundation that has patient assistance. And then making sure that you're also exploring local options. So a lot of times local healthcare systems might have assistance programs available. And local pharmacists also are a great resource. Talking to your pharmacist to see if there is anything else you could be looking at or exploring that they're aware of, or resources that they might have insight to that could help drop the cost of that medication for you. And again, if you do run into issues here with any sort of medication coverage, you can always reach out to us. We can help go through different options, explore all of the resources out there, and make sure that we're turning over every stone. And then also it helps us to hear these stories of people having issues with navigating cost and insurance, because then we're able to help raise the community voice and say this is not acceptable. People aren't able to afford these life-saving medications. So don't hesitate to reach out to us with any of your insurance questions as well. Okay, so now that you've gotten your medications and you've gotten them filled, this is a couple of great tips and tricks for making sure that you're staying on top of taking your medications. Pill boxes are great. I know they can sometimes look cheesy, but I learned recently that there are fancy pill boxes out there as well that can be designed and be nicer. And it's a great way just to make sure that you're taking your medication every day in a very easily to see visual format. Another trick is setting up daily reminders on your phone. So if you know that you are going to be taking your medication at a certain time every day, set that reminder, just don't think about it. There's also medication tracking apps out there. Some people like those. One of the things that can also be helpful is incorporating it into your daily ritual. So in the morning when you wake up and brush your teeth, like take your medication then, or with breakfast every day, or if you're taking it at nighttime when you're getting ready for bed, but find a way to make this a part of something that you do routinely without having to think about it. Again, avoid taking medications with grapefruit for some of these medications. It is specifically with statins that can sometimes make the medications less effective than they would be otherwise. But that's something that should be on the label of the medications. And if grapefruit is a big part of your life, ask your pharmacist about that or your doctor about that to know that if there are any not contraindications, but any situations where your medications might interfere with that. Another important thing is to not stop taking a medication without consulting your healthcare provider. So if you're having any sort of issue or decide to stop, like you don't think it's helping you as much as it's hurting you, if you're having like weird side effects, make sure you call your healthcare provider about that to talk with them. Don't just stop taking it. Another useful thing is setting refill reminders for prescriptions, or if you can set up auto refill, that's great. Also, I know a lot of places now do 90-day supplies of medication. So if that's available, again, that just takes one extra trip to the pharmacy off your plate. Okay, so then following up, after you've been taking your medications, making all of those dietary and lifestyle changes, getting your lipids retested when you're scheduled. So again, ideally 6 to 12 weeks after any medication changes or after starting a new medication. Plan for how these follow-up results will be discussed with you. Is someone from your doctor's office going to call you? Do they want you to schedule an appointment? Do they use a patient portal? But make sure you have a very clear plan for how those results will be discussed with you and disclosed to you. Also, it's important to track your results and keep a timeline. If your LDL cholesterol goes down, make a note of that. It's also important in that not just tracking your lipid results, but jot down when you started taking the medications. So down the road, if you're at a totally different healthcare system, you have this historical record of what your cholesterol was, what your medications were at the time, what the result from that was, and kind of create a little history, a chronological history of your cholesterol journey. If you couldn't schedule an appointment at the time of your visit, setting that phone reminder to schedule a follow-up call when you can to make sure that you're not falling through the cracks. And then noting any side effects if there are any. Again, I know there are a lot of concerns out there about side effects, but if 100 people are prescribed a statin, 90 of them will have no side effects at all. 10 might report some side effects, but only 2 of those will have side effects to a point that lead them to discontinuing the drug. Also, when it comes to side effects, I think it's always important to remember what else might be changing in your life. A lot of times people will start taking a drug when they're going through other situations, like if you're going through menopause, if your body is just going through the normal process of aging, if you had any other changes in your life, is it possible that these side effects might just coincide with you starting taking that drug, or is it truly attributable to that drug? I think it's also important to remember that you're always weighing the kind of risks and benefits when it comes to side effects. So for some people, if there is maybe mild discomfort, some mild myalgia with taking a statin, is that mild discomfort worth the risk of stopping and ending up having a higher risk for a heart attack? So it's kind of balancing the pros and cons. A lot of times too, the side effects might diminish or go away over time. So really weighing whether tolerating a little discomfort is worthwhile for the overall protective effects that these medications would be having. And a lot of times too, making sure you're discussing those with your doctor. So sometimes what you think might be a side effect, might be attributable to something else going on in your life. So having that conversation with your doctor about what you're experiencing, and they can say if it's something that they've been familiar with before, if it's something that's been reported on, or it might be attributable to something else. Okay, so I want to round it out here by kind of talking about staying informed and up to date on the current state of cardiovascular disease and cholesterol management specifically. I think one of the important things to remember is that science marches forward. It's progressing over time. Many things change as we learn more and more and have a better and better understanding of cholesterol and heart disease. Recommendations for screening change over time. So the frequency of screening might change. The ages for screening might change. There are treatment goals which change. If you remember from, I think it was the first session when we were talking about kind of over the years, what we learned that the lower the LDL seems to be better and better. Those targets for what a person's LDL cholesterol should be has changed. Just last year, the ACC added that caveat of for people with the very highest risk should ideally be at less than 55 milligrams per deciliter. So there are definitely things to make sure that you're staying up to date on and that your doctor is also informed on. New drugs also become available or approved for new indications. So drugs that are out might become approved. Like if something was only approved for one indication before, maybe there's a label change. As some of these new drugs come out, especially in the coming years, and we're expecting drugs that specifically target Lp(a), keeping up to date as when things become available and what they're approved for. Also, medication labels change. So, for example, not too long ago, the FDA took the black box warning off of statins for women who were trying to become pregnant. So it used to be that if someone was trying to conceive, they wouldn't necessarily be recommended to be on a statin. But recently there was a label change that said that it's actually okay to be on a statin up until the time you realize you're pregnant. So even drugs you've been on for a long time, there can be new evidence that comes out that might slightly change the calculus for you. Another way to stay up to date is either following clinical trials, or if you're interested in participating in clinical trials, it's something to consider. There are many different clinical trials available, not only for LDL cholesterol, but for Lp(a), which are in various stages. Some of these clinical trials are more observational studies where there's tracking people over time, and some are those clinical trials that are testing a new drug versus an old drug, or a new drug versus a placebo to see if it reduces the risk for cardiovascular events. Participating in clinical trials, there are always pros and cons, but it does allow folks to be engaged in your own healthcare while contributing to the greater good, and it helps improve our understanding of this cholesterol space the more people participate in clinical trials. If any of you are interested in looking at what clinical trials might be available, we do have a page on our website, familyheart.org/clinical-trials, where this might be a little hard to see, but it is actually connected directly to the clinicaltrials.gov website, where all clinical trials are registered and kind of publicly available to see what trials are out there. You can filter by your condition, so you could even just click high cholesterol, or there's lipoprotein(a). You can put in some demographic features, and it'll search and pull up what trials you might be eligible for. You can also sign up for clinical trial alerts there. So if you want to be alerted when new clinical trials are launching, there's a little option to put your name and email address in there, and you can keep abreast of what is going on in the clinical trial space. So another thing I want to mention is the importance of vetting your sources when it comes to staying up to date on information. I think there's a lot of misinformation out there, and it can be hard to weed through some of that. So this is just a little bit of tips and tricks to make sure that you're getting the most accurate information. So I think there is a hierarchy when it comes to where your information is coming from. I think scientific publications are kind of the top of that list, or articles that are actually citing their sources. They're citing the scientific information are always preferred over a blog post that is making outlandish claims without backing any of that up. Another important thing is, what are the author's credentials? Like, are they knowledgeable enough to be speaking on this? What are their motivations? I think a lot of things that we see, unfortunately, is people out there who are making claims about supplements, and it turns out that they're actually selling those supplements. So they have a vested interest in trying to say that this is better than taking medications. And then trying to look for multiple sources. So if you see something, if you read something, if it doesn't sound right, trying to see who else has looked at this question, who else has spoke about this question, are there people backing this up, or is this something that seems to be coming just from one person who might have a different agenda? And again, we're also always here to help with, if you hear something, we try and stay very up to date on what is out there in the zeitgeist when it comes to cholesterol. So if you hear something and not sure if that sounds legitimate, don't hesitate to reach out to us and give us a call, and we'll help get to the bottom of it. There are also a couple of red flags. There are number of things out there that are should throw up a warning sign in the back of your head when you read them. I think two of the biggest ones is anything referencing the great cholesterol myth or the great cholesterol con. I think a lot of the information that is related to those books and the authors of those books has been discredited pretty thoroughly and debunked at this point, but we do still see a lot of it making the rounds, especially on social media or various blog posts. Also, people saying cholesterol doesn't cause heart disease. I think this is one of those things that we will see a lot out there, but the evidence is pretty clear at this point. Like, it's not really up for debate anymore in the scientific community. And that's been proven and proven over and over again. And the science is absolutely crystal clear that cholesterol is involved in atherosclerotic cardiovascular disease. Also, harkening back to Mary Card's dietary session in session 2, dangerous dietary advice. So anything that recommends completely removing something or taking on a very extreme form of any diet maybe should raise a little bit of a red flag to see what is this based on. Also, things that just sound too good to be true. So clickbait articles, completely reverse heart disease with this one simple trick. I love seeing these, and I'm kind of surprised with how much they still make their rounds. But anything that is trying to lure you into a website, probably not necessarily to be trusted. Social media posts always take with a grain of salt. There's a lot of great people out there on social media that are putting a lot of excellent information out there. But you never really know who it is and what their agenda is and what their motivations are. So if you read something on social media, maybe going back to those other sources and seeing if you can confirm that or see what they're citing, to make sure that you're not being misled by somebody who doesn't necessarily have all the information. There's also a couple of doctors out there with either dubious credentials who aren't necessarily specialists in this area, or doctors that have been discredited. So kind of doing a little background check on who this person is that's telling you something, or something you read, kind of doing a little digging to find out if they've had any sort of controversy surrounding them in the past can be helpful. And then I think one of the other things that's important to consider is doctors who are unwilling to consider Western medicine. So I very much think that complementary and alternative medicine do have a space in healthcare, but I think that has to be completely balanced with what we know about Western medicine, and can't just be taken in a vacuum without taking into account the kind of current state of the science as it stands. So a couple of good sources here. Obviously, we have a ton of information on our website. We try and put out blog posts, put out new webinars as things change, try and keep everybody up to date on FH, Lp(a), and even high cholesterol. The National Lipid Association is also great. They have a lot of great information that comes out. Lipid.org is their website. AHA, the American Heart Association, Academy of Nutrition and Dietetics. Nutrition Action newsletter has some excellent information about nutrition and how that relates to other facets of health. And then checking with your local healthcare system website. A lot of websites do actually have a lot of great information out there. So searching for the information, just where you're getting your healthcare already, can be a great resource. All right. So with that, I want to thank you all very much for listening to me talk for a little bit. We'll get into questions in just a little bit here. Again, just another plug for our ldlsafezone.org website. A great place to go check out, learn some more information, see some of the stuff we talked about here, help understand better your risk for heart attack or stroke. And if there's any questions that are specific to your care that you need help with or guidance, we are more than happy to help assist you as you are finding those answers. familyheart.org/care is where you can reach out to us there. There's a portal where you can submit a question to us, or you can give us a call, you can give us a text, whatever is easiest for you. We'd love to hear from you if we can help you in any way possible. And yesterday was Giving Tuesday. If you're still in the giving mood, your donations are always very much appreciated here at the Family Heart Foundation. We are incredibly grateful to our community who does a lot of support for our nonprofit organization, helps us to achieve the mission that we're all driven by here. With that said, I will go ahead and open it up for questions.